I just think authentic intelligence means being able to deliver solutions more so closely to the level a human would, like more so in alignment with like AGI perspective, really brings about enabling current LLM-based models would be to bring in the appropriate context. Context is important. Context is everything, right? What diseases they had in the past, and like the age, the demographics, and so on, right? That's sort of the first data point. Like you could give the LLM as context. You need to factor in explainability and transparency while building that model, right? Like,
Keshavon, I want to welcome you to the Signal Room podcast. For our listeners, we are live at Planet Hollywood in Las Vegas, Nevada for the Data First conference. We are here talking about all things AI, ethical use of AI, machine learning. It's the buzzword of the day kind of conference, I think. But I just want to welcome you, Keshavon Seshadri. Keshavon is the senior machine learning engineer for Prudential Financial. For people who don't really understand what that means, maybe tell us a little bit about what do you do in your role, and then we'll kind of get into some topics that are top of mind for you.
like you said, I work on pretty much everything that's exciting, and AI being the buzzword. I work on the right in the center of it. I work on building machine learning platforms, generative AI-based solutions, and like agentic frameworks, and anything that's new, right? I work on that. Yeah.
You're not hiding your excitement. I love that. It is exciting work. I think people are a little bit fearful of it, but I think conversations like we're having today are important because it starts to help people to understand. The only thing to be fearful of is not learning, honestly. And so the topic we decided to talk about is authentic intelligence and designing AI that understands context. And this is a little bit of a nuance that I don't typically hear from a machine learning expert about. But if you don't mind, could you talk about authentic intelligence and what does that really mean to you? And how is it different from artificial intelligence?
I just think authentic intelligence means being able to deliver solutions more so closely to the level a human would, like more so in alignment with like AGI perspective, right? And what really brings about enabling current LLM-based models would be to bring in the appropriate context, which is where we're at, right? And this involves both like short-term memory context, and then there's like long-term memory context as well. And I think in this field, right, like in terms of healthcare, context is one of the most important things because there are like different types of context one could bring about. And like when you do design any sort of AI solution, be it like an agentic AI or like more so an autonomous AI system, right? Um, Context is important. Context is everything.
Yeah, totally. I mean, you mentioned the healthcare field, in clinical and administrative workflows. Where does context break down the most, do you think? And how can AI be designed to recognize its own limits?
Right. So in terms of healthcare, right, like I see four different types of context that one could bring about. The first itself being like the patient context, right, like their health records, and they sort of like the what diseases they had in the past, and like the age, the demographics, and so on, right? That's sort of the first data point. Like you could give the LLM as context, and then there is this another interesting context is about like if you were doing a task, right, like be it diagnosis or you're doing maybe uh, you're working on something else in healthcare, like maybe in assisting with surgery. Each of the task itself has a different context, right? And like different set of ways to go about performing that task. And then there's another context, which would be in terms of if I were to diagnose something today, right? Like, do I have the doctors and my doctors near me, or like, doctors in the hospital available right now to actually, help with the diagnosis, or like, finalizing the surgery, or be it any task, right? So you need a human in the loop as well, right? And you also need to tell the LLM or the AI model which doctors are available right now and which ones could I bring in to help me solve the problem. And then there's another context, which is in terms of like compliance and regulations and institutional context, right? Like each hospital has their own set of policies, and then there's governmental regulations and compliance requirements as well. So there's like four different types of context one could bring in within like healthcare.
You touched on the compliance area. There's a lot of apprehension and outright fear, honestly, out there, particularly in the medical profession, just because a clinician understands the need for context probably better than most people. It's just the training that they've had for years. They know inherently where to go to find specific types of resources. Um, Based on all their training, it could be their studies or research that they've done, but that may not be an obvious thing for a machine or an algorithm to even deal with. Talk about how you see this capability kind of coming alongside in assisting a clinician, and how can we use it in ways that we're enabling judgment, and how do you design, do you, from your perspective, are you designing first by having these conversations and doing some research along with some clinicians, or but how do you see things evolving in a way that can actually be meaningful, where adoption becomes just a natural part of the process, as opposed to it's a sales pitch that you have to give your physicians to try to use it, and you can trust it?
I mean, obviously, working with the physicians and like collecting the data and collecting all those, doctor-patient conversations and whatever is allowed, right? Like collecting all that data and figuring out a way to train the model, right? Sometimes, right, like the general purpose LLMs might not really be up to the task, right? Like say for diagnosis, it needs more context, and context could be given to the LLM post training or pre training itself, right? Like before I train the model or like while I train the model, I sort of give the necessary context that it understands, like what is a disease and like how do you diagnose the disease and like what sort of symptoms you need to look at and so on, right? This is something that could be given uh, as data before even like working on the model, right? Before like training the model, right? So maybe we can think of this as like creating new uh, LLMs or new models, new AI models to uh, help with different tasks, right? And another way we could think about is like fine tuning or context engineering in this case, right? Like bringing in the necessary context to a more general purpose advanced reasoning LLM, like the GPT models, or right, and giving that context while it's making the decision or like making the sort of make trying to understand the problem, right?
You touched on something that I think is really worth digging a little bit into. Physicians get the basic core foundational training, and then they specialize, right? Your cardiothoracic surgeon is not likely stepping over to do the endocrinologist job, and vice versa. Um, when you're talking about some of this nuance and the way you're developing these models, what do you think it's going to take to develop models that are really built in such a way that it really supports these? I don't want to call them structures, but basically they're almost sub verticals underneath the clinical profession of a physician. So how do you think about that? And do you think it's going to be something where we're going to basically, for every specialty or subspecialty, we're going to have specialized large language models that would support those workflows?
Yeah. So if you see, right, like let's go back, let's take a step back and like see how humans do it right now, right? Like humans have, or like the doctors, right, like they take a more general course for first few years, and then they sort of like do some sort of residency training and like, um, you know, figure out how to work within the hospital, right? Like, and then they choose a specialty, and then they repeat the process, right? And the training sort of takes about 10, 15 years. That's what I heard. Like good doctors even keep on studying until like late 40s, right? So
So they're not interested in just assuming your AI is going to be ready to go then, huh?
yeah, so AI is not going to be, the specialized doctor that you're looking for, but it could certainly help with like more general purpose, um, like at least the current models that we have, like the general purpose models, right? Like they could be more so like a, you know, uh, a student in the university, right? Like it's I feel like a university grad or something, right? Like not yet a doctor, right? And we do need like specialized models, but even then, there's like a chance of error, right? So I wouldn't really call AI as a doctor at the moment, or like at least in the next few years. It takes a bit more, and like we need to build like mechanisms for evals, mechanisms for guardrails, and
Right.
it takes more time. Yeah.
Yeah. Yeah, I think supporting human judgment is a really good way to think about it, and probably the safest place we can stay focused on in the near term. Um, who knows what things are going to evolve? I'm hearing discussion about things like super intelligence and like super artificial intelligence. I thought what we're doing right now is pretty remarkable. I'm not sure if I'm ready for these advanced things there people are thinking about. But if they're already thinking about it and talking about it, I'm gonna guess it won't be long before we start learning a lot. Oh, it's definitely a time to be paying attention and learning what we can now and figuring out how we can use it to our advantage. Uh, if you're thinking about the balance of efficiency and automation, um, how do you think we account for the built-in checkpoints where we're looking for human judgment? Because when you're talking about it needs to be designed with context, it also kind of needs to know when a human being needs to get involved or provide guidance or judgment call or whatever. I mean, how do you think about that, and how do you build that into your models that you're working on so that there's deliberate stopping points? Because I've noticed in generative AI in particular, unless you're asking it to prompt and ask you questions, it assumes you're telling it what it needs to know.
Yeah. 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 I mean, right now the models, right, like work based on probability, right? Like it just predicts the next token, and not even like a next word, more like a next subword, like all these LLMs, right? So and then it assigns sort of like a score, right? Uh, which word should come next, right? It's essentially doing that,
It's like
like
it's
sort
like
of rank.
an advanced version of what Google did a decade ago to us, finishing our sentences.
Yeah, yeah, yeah. It's pretty much doing something like that, right? Um, it's not yet at a stage where it can completely understand what it's doing, right? At least with the models that we have right now. So, in terms of like relating back to your question, um, like when you do design these models, right, like the AI models, you need to build like an eval set. Like you need to give how or like have a mechanism or guardrails in place when to, defer to a human, right? Like
Right.
that's dependent on the score, like a confidence metric that we can put in place, right? Like maybe if the confidence score is greater than 0.9, or like if it's then you're pretty good to go, right? But like when it, and also it depends on the risk, right? In terms of saying a patient has cancer when he doesn't really have, that's okay. But like that just leads to an extra bit of tests, and like you have to um, you know get like you have to order more tests, and that might become expensive for the patient, right? Like so that's okay. That's like okay in the sense okay to an extent, uh, versus like if you say a person doesn't have cancer when when they do actually have cancer, that's even worse, right? Like missing a diagnosis.
Yeah, and hopefully we're smart enough to know that we cannot let our AI models of any kind automatically make a decision and drive outreach and communication.
Of course, we have a human in the loop. It's just like the first trial, right? Like even when you sort of give those decisions, or like the AI's judgment, you also need to include sort of a confidence score on like a risk metric, so that like when the human looks at it, it the human understands, right? Like the AI probably tried to do a good job but couldn't, right? Based on the current patient's current reports, or like their model's underlying knowledge. So pretty much like giving the human a metric to look upon. right? So they could evaluate the answers from the AI model. That I think that that's what we need. So this comes back to like precision versus recall versus like different other metrics that you can potentially include.
Yeah, I mean, it's interesting you mentioned recall. It's one of the things I got excited about, early on. And, one of my good friends is here. Actually, he's working on some things behind me. He's a physician by training, and he pointed out very wisely to me when I was excited about having the ability to perfectly recall things that sometimes the things that we have learned experientially aren't found in documentation, and therefore AI might not even know about it. So the fact that it can remember something that I documented a decade ago may not actually be relevant when I think it is. If I'm just thinking about it from an algorithm standpoint and what AI is actually going to refer to because it just happens to be there and it's in the model. Um, it kind of leads me into another topic, kind of around that. It's bias, but not the kind of bias people typically think about. It's like, what does AI not know about that's causing it to perceive and answer prompts in a certain way?
Yeah, so AI is trained on data, and like the large language models, right, more so commonly are trained on like the entire internet, right? Right. Entire internet, the books, like pretty much anything you can crawl upon. They train on a lot of different, right? Yeah. So it's like if you put in good stuff in, like in terms of like the training the model, good data, then like you get good results, right? If you put garbage in, then there's garbage out, right? So it's essentially that.
It's so when you're dealing with that, the bias piece of it, but then, and I think about how that can impact things like explainability, right? And there's a fair amount of legislation that's already come to fruition. I know there's a lot passed in California recently around requiring transparency for healthcare providers who are actually using it. But the second piece of that was not just the transparency, but it has to be explainable, which is different in healthcare because we really do need to make sure that we're providing enough understanding so a patient can make an informed decision around whether they want to have their data being used that way. As you're thinking about the things that you're designing, you're building, and people that you're working with, how do you all think about really building in the ability to address this right from the outset? So it seems like after you've delivered the first product, it might be a little late to have thought about how do you make it not only transparent but explainable. Because I mean, you've been very articulate and easy to understand for me so far, but I would be willing to bet that if you start telling me the real details of the work you're doing, you would lose me completely.
I mean, and not so much. Like it all sounds fancy, but it's actually really quite simple to understand. It's not that difficult. And in terms of explainability, at least, right? Like you need to work it along with the design, right? Like when you do design an AI system, right? Like not just like an LLM or like a model, right? But like an entire AI system, an autonomous AI agent or something of that sort. You need to factor in explainability and transparency while building that model, right? Like you need to have proper logging, proper ways to, you know, have LLM as a judge, have LLM, go and like try to explain me why it took a decision, what tools did it call, what agents did it call, and so on, right? Like this is sort of what goes behind the explainability, and showing that explainability to the user is what brings in the transparency as well, right? And also it addresses bias, because if there was bias in the decision making, right, like, and the AI is able to explain that it had like sort of a bias, when there's another agent or a human that looks at the ex- uh, looks at what the AI explained and then figures out there's some sort of bias in the decision, right? They could potentially flag it, right? And then you don't really show it to the user if there's like bias in the decision making, right? So and like there's another way to think about bias itself. You could have potentially feedback loops, okay, right? That like when a user or like a human or another AI flags a particular response, the feedback is sent back and it is sent back to the model and it sort of like fine tunes it itself, right? Right. So this is called like reinforcement learning based on human feedback, right? So that's pretty much what like most of these AI systems are now trying to build. Yeah.
I want to ask you to maybe tell on yourself a little bit, or maybe not. Maybe it's told on someone else. I don't know. But can you think of a moment where an algorithm produced an insight that was technically correct, but contextually it was wrong? You- And, I guess where I'm going with that is there something that you can point to that just gave you an insight about um, human and machine collaboration and why it's so critical? Because you could get the right answer, but delivering it in the wrong context could be really a really bad thing. I'll give you a real example that probably people would remember. It was a number of years ago. There was some capability that was driving some patient engagement kind of activities. And the father got alerted because his daughter had purchased a pregnancy test at a pharmacy. Um, right information, contact was not so good. It would have been better. It's handled a little bit more sensitively. So this young woman didn't get direct communication. It went to her parents. No opportunity for any kind of healthy exchange in a way that would have made the girl feel safe having the conversation. It's kind of nuanced, and it's definitely about the human relationship part of it. But that's kind of what I'm thinking about. And are there things that you can think of where you've seen that? Okay, right answer, but
Yeah. Yeah. I don't know if you've used ChatGPT nowadays, right? Like, what it does is it sort of acts like, more so personal, right? Like it talks to you and like tries to understand what you are and like has a short term or sort of memory stored about you, right? Like, and every answer, right? Like every answer that the model gives, it ties it back to that, ties it back to what you are, right? Right. So maybe I ask a scientific question, right? Like, what happens if you consume so and so during pregnancy, right? It might be, it might be that like the AI answers it like based on textual facts, but then actually telling it to the, to the person asking the question, that might not be the best approach, right? Like, right. It might be insensitive, or we don't really know, right? Like the answer could potentially cause like negative feelings or negative impact. Sure. Which we don't want as like the people who design AI. We want people to have like a positive impact on the world and like right. That's pretty much why we want to design AI, right? And when we do design these systems, we want to bring in that human feel or human touch as well. Like when we cannot potentially rely on AI to bring in that human touch, we need a human itself to actually give the answers to the person, right?
yeah, it's such an important thing to remember. I think the realization that I I was talking to an emergency room physician a couple of years ago, and one of the things he brought up to me was even the way that we do analytics for quality reporting, whether it's for CMS or any regulatory agency, things are based on averages. And one of the things we have to be keenly aware of is you're not going to find an individual that looks like the average that comes from this mountain of data that people are looking at to create the metrics. And a really risky example that I hadn't really considered, if you're an emergency room doctor and you see me without knowing anything about my history, and you see that I've got a high blood pressure, or but you could see my blood sugar seems outside of a normal range to you based on averaging. If you don't know what is normal for me, you might overreact and prescribe something that actually can cause an unintended adverse reaction. And I think what we're talking about is a really, really important area that we want to make sure that people are mindful of. If you've got a podium and we're talking to however many people are going to be listening to the podcast, what would you tell people who are designing AI and designing these models, large language models, that they should be thinking about? Are there some maybe two or three things that you would tell them that they should really be doubling down on now while they're designing that'll help to prevent them from getting into situations where that contextual awareness is just it's not adequate anymore?
Yeah. I mean, the first thing is like when you use a model, right, like you first need to understand, like, where and how it was trained, right? Like what data was it trained upon? Maybe you use a model, right, like that was trained on like a data set specific to a location like US, but then the doctors are in Europe, or it might not really work because like the demographics change, like change the diagnosis, change a lot of different things, right? So when you design a system, you first need to understand like what model to use and like what data has it been trained upon. Like when you decide to use that model, you also need to ensure that you use it for the right purpose it was intended to do, right? Like if you're using a general purpose LLM, you should really understand that it was just designed for general purpose and not really something specific to, uh, you know, designing a medical system, medical AI system, right? So data is important, and the context you bring in should be as much thorough as possible, right? Like it should bring in all possible factors. Like I said, like the four different factors, about the human, about the institution, about like what sort of problem we're solving, and if there's a human that we could defer or delegate the responsibility to, and like what humans are available, right? Like so it depends on as much as context as possible,
Right.
and again, as much good data as possible, right?
So you're not recommending people design without humans in the loop for just everything.
Not right now. I do. I mean, I think some of the tasks, right? Like it depends on the risk each task has. Diagnosis has certain level of risk, versus something like surgery or like making the decision on the spot whether to,
Yeah.
make an incision like 5 millimeter or 3 millimeter. That is something like really, really needs a human in the loop, right? So it depends on the risk. And then like when they do design and design these AI systems, the models that you use needs to also incorporate like the explainability and transparency. And also and the third thing is it needs to have good eval system, good testing mechanisms, and guardrails in place. Like guardrails are pretty much the most important thing when it comes to like extremely regulated compliance required fields like healthcare, right?
Right. So as we're wrapping up, if folks wanted to get in touch with you, how can they find you?
They could find me on LinkedIn. Yeah, and potentially I could. Yeah, LinkedIn is where I'm most active, and I would respond via emails as well. And it's my first name, last name at Gmail.
Well, I'll make sure that we put everything in the show notes. So if you're listening, you want to reach out to Keshavon, we'll make that really easy for you. Keshavon, it's been such a pleasure to have you on the Signal Room, and great to meet you here. I'm excited to continue having some great conversations the next couple of days while we're here in Las Vegas.
Of course.
So
Yeah.
thank you very, very much.
Yeah, thank you so much, Chris. Thank you.
That's it for this episode of The Signal Room. If today's conversation sparked something in you, an idea, a challenge, or a perspective worth amplifying, I'd love to hear from you. Message me on LinkedIn or visit signalroompodcast.com to explore being a guest on an upcoming episode. Until next time, stay tuned, stay curious, and stay human.